Well, congratulations, Mr. User, for controlling your blood pressure. And now, though we have problems na encounter, especially your weight, as well as your sleeping pattern, ibang usapan na kasi itong dalawang factors. Most likely, they're all intertwined with lifestyle. No? Una, your weight. Weight can be a big problem, especially if, let's say, for example, it can trigger as a driver for hypertension, diabetes in the future. Kudos sa'yo na monitor mo na yung blood pressure mo at nakokontrol na siya with the help of your cardiologist. But it's also important to target those secondary risk factors like your weight. Okay? Focus more on adding a bit of exercise. Siyempre, weight can be managed by exercise and diet restrictions. So exercise and proper diet should be added in your protocol. Now, paano ba magsimula? Paano ba magsimula sa exercise? Now, let's try to add more steps. I would always advise my patients take a morning walk, at least 5 to 10 minutes in the morning, then 5 to 10 minutes in the afternoon. Now, paano mo masasabi kung may quality of exercise ito? Medyo bumibilis yung pintig ng puso mo. If you have a smartwatch, you can monitor your heart rate. It should be within a targeted heart rate na pwedeng i-calculate ng iyong doctor. It should be within the zone 2 na sinasabi namin. Dapat masustain mo siya for 15 minutes or 10 to 15 minutes during your exercise. Doon ka lang dapat mag-start ng time. Now, once you do this routine every day, okay, siguro kung di mo kaya every day, 5 times in a week, okay, that's a good starter. Now, another thing is, if you are working an office desk job, doing your stuff on the computer, iwasan mong nakaupo lang, okay, for more than 1 hour. Try to walk, have a pace na be active for at least 10 to 15 minutes. Kuha ka ng tubig, magbanyo ka, para lang cut down yung sedentary activity mo. And that is one important habit for physical activity. Next is, yes, don't forget your afternoon walk. Same din with the morning walk. And then you could add on an exercise na it can help in increasing your muscle build. Because kapag meron kang increased na muscle build, it adds more on the consumption of extra calories. So if it needs more extra calories, maghahanap siya ng source ng energy. So kung let's say controlled mo naman na ang blood pressure mo, it can take some of that energy from the fats and it can further convert that to energy. And if it loses, okay, that fat, it also incorporates losing weight. Diba? So that's a good sign. Pero kung gusto mo ng proper guidance, it's important that you seek consult with the doctor para mapoprovide natin ng maayos ang proper exercise prescription mo. Now, for sleeping pattern, yan, mahaba na naman to. Pero bigay ko na rin. Sleeping pattern, look for the word sleep hygiene on the internet. There are certain steps to help you increase or provide a quality sleeping pattern. Okay, sleep hygiene is usually the term that we use. Matulog na maaga, 8 o'clock p.m. Make it regular, every day na tutulog ka ng ganung oras. Kung di 8 o'clock, 9 o'clock, okay lang din. Basta every day, dapat 9 p.m. tulog ka na. Okay? Have a shower. Okay? Make sure that you're comfortable. And then, avoid using your phone an hour before you go to bed. Avoid bringing your work to your bed. Okay? And at the same time, avoid extra noises during the time na kailangan matulog ka na. Now, to uplift yourself, ang kadalasan ko din sinasabi sa patients is, you try to write a diary, you try to write a journal. Write 10 things or 5 things na lang that you are grateful of that happened today. And then, name or write down at least 2 things that you're expecting for tomorrow. That way, you will be sleeping at least in a positive note, not thinking of any extra burden or nakakapagod na trabaho. Kasi more likely, fill your mind with something that is positive. And, well, dun sa sinabi kong avoid your phone at least 30 minutes before you go to bed, that helps produce, okay, melatonin. Hindi mo kailangan uminom ng melatonin na capsule because your body creates that melatonin. The only reason why it does not produce enough melatonin is because you're doom scrolling or you're scrolling on your phone, okay, hanggang magdamag. Okay? So, dapat iwasan natin yung mga ganong sitwasyon. Okay? Those are few tips. And if you want to know more about some lifestyle interventions, you could see consult with a doctor, a family doctor, like myself, or you could also inquire with a lifestyle specialist. Okay? So hopefully, control din natin yan in the future, ma'am user. User 27985. Wala kasi yatang active na account na yun. No? Pero again, hopefully nasagot ko yung tanong nyo. Again, this is Dr. Sir Alan, family doctor, making medicine easy for you to have a healthy life.